Will you talk to us about some of the most common allergens that you see in the pediatric population? Is this the same for adults? Are there some food allergies that we're seeing more and more in children?
in children. So we definitely in the baby, dairy and soy are probably the number one food allergens or food reactions we see in the infants. And as they get older, it becomes more like the adult population where you start to see gluten and wheat playing a bigger role. And then I would say egg. Egg is quite common because there's a lot of cross reactivity with dairy with egg. And then we don't see too many nut allergies in our clinic because those are generally managed by the allergist. And so those are probably the most common ones we see. And we didn't I don't think it really has. I hate to say I've been doing pediatric GI for 20 years, but I've been doing pediatric GI for 20 years and it really has gone it really has risen dramatically. And not just single allergies, kids with multiple different food reactions, food allergies, and then the nutritional consequences of them, obviously, are pretty profound too.
hmm You mentioned earlier that there can be a pretty wide spectrum of symptoms that we might see. And I think many of us are prepared to look for immediate GI symptoms, or if someone has a swollen tongue and it's hard for them to breathe. I think we're all prepared to look for that. But I imagine that, especially in the pediatric population, there are some more nuanced or subtle symptoms that we might miss if we don't know what we're looking for. Will you tell us some of those common or maybe not so common signs and symptoms that we should be looking for?
So definitely growth is probably one of the most important non-GI symptoms that we follow in the pediatric population. If you take your child to the pediatrician's office, everybody has a growth chart. We use Epic and it's nice because the growth percentiles are in a color. And so we always show the families a chart and say you just need to you need to pick a color and you need to stay on the color. So once kids start to drop off the growth chart, whether it's their height velocity or the weight gain, even if they don't have any GI symptoms, that clearly needs to be evaluated. Delayed puberty is also another one. So if we have boys, usually it's more boys, but if their boys are having problems going into puberty, then we always worry about a nutritional deficiency or a food related issue. And then there can be outside of those things, which are kind of growth and nutrition, definitely, eosinophilic esophagitis and leg pain. Who would have ever thought that those two go together? But that is not uncommon. Obviously, rashes, a lot of headaches. People get a lot of headaches when they're having problems with food. Their energy can be impacted. And some families notice differences in their attention too when they've identified certain food triggers. Acne, I would say, can sometimes be a symptom of you're having an issue with a food. So hopefully that answers
Yeah,
your question.
really helpful. And you were right. It seems like multiple body systems are involved and we're really looking at a wide variety. And I understand that there are reactions that will happen immediately and reactions that might be more delayed, which presents a certain set of challenges when you're trying to make this diagnosis. What does that look like in the real world? What's the time frame in which we could observe a reaction to a food?
I would say, obviously, the IgE related foods, that's going to be within hours. And usually the intolerances are fairly quick too, within a couple of hours. If you have lactose intolerance, usually you have a problem within a couple of hours. Or if you're having a reaction to a dye or histamine, it's usually within a couple of hours. But the food sensitivities, it can be hours to days. And I feel like their symptoms are more kind of just up and down. And so families just aren't usually able to figure it out without either doing testing or an elimination diet because they don't jump out at you as much. They're not so, oh, I had that food and then something terrible happened. It's just that I just don't feel good every day and I know something is wrong and I need help kind of figuring it out.
We talk about that when we teach about the elimination diet here, right? That you have to wait sometimes that full 72 hours after introducing a food because maybe you're going to get a headache or a migraine or
Yeah.
have something pop up a little while
And I
later. And
actually I love the IFM symptom tracker. I think
yeah,
it's a really nice tool to help families when they're putting food back in.
Yeah, to help look for some of those subtleties. Now, let's say we don't catch something because it was difficult for us to identify. We didn't know what we were looking for. What are some of the potential health consequences for a pediatric patient if we just don't catch these food reactions in time?
So the probably celiac disease has the most profound long-term complications. We it's actually not uncommon for us to diagnose a pediatric patient and then realize that the parent already also has it. And then the parent has probably had it for years. And then you look at the family history and they've had a history of infertility, or they have a history of osteopenia, or, something like that. So celiac disease, those obviously have pretty profound implications. Some of the other ones, we know for sure that if celiac disease is missed, that you have a long-term increased risk of other autoimmune diseases. We definitely know that failure to thrive, lots of nutrient deficiencies. We see lots of nutrient deficiencies in the pediatric population, iron deficiency, but also B12, not uncommon. So I think those can be negative long-term impacts. Growth, if kids are developing feeding issues and restrictive eating around food, if they don't have enough calories to grow, then they're not going to gain weight and grow. And if you think about it, most 2 to 3 year olds have to eat like 2 to 3 times what we would have to eat per body weight for them to grow. So, they miss 100 to 200 calories a day, and, suddenly they're not growing. And then that impacts their school attention, that impacts their susceptibility to infection, impacts their brain development. So there can be a lot of long-term implications if we don't identify the right disease. We need to make sure we give them the right diagnosis.
Mhm. Yeah. You've mentioned both cognitive function and the health of our mood, and makes me think of the gut brain axis, and it's something that we talk about so often. Is that something you see frequently in your practice with children who have food allergies or food reactions that maybe haven't been addressed right away? Do you see changes to behavior or to their mood or to sleep that then improve after you remove those foods?
Yeah, I mean, without a doubt, when especially the younger kids, when they don't feel well, they don't act well. They don't sleep well, they don't listen well, they don't sit still in class well. So the younger kids, it is usually more kind of acting out. And then I think the older kids, I don't see as huge a link in my patient population with, I would say, depression, but anxiety. There's a very big connection because to the teenagers in particular, they become fearful of eating. And so they worry that, when they do eat and they're out with friends, that they're going to have to go to the bathroom, or they're not going to be able to attend an event or get through soccer practice. So they develop a lot of anticipatory anxiety around food and just around just eating out in general or eating at home in general. And so that can be a really big struggle. And then we talk a lot in the clinic about disorders of the brain gut interaction. And we just try to get families to really understand that you're not just a heart. This is like why I love functional medicine, because it's really given me the tools to really explain this to family. Like, you're not just a intestine or a stomach or a heart or a brain, that you're like this unbelievably complicated individual with different genetics and different environment, and you have different things that make you happy, and you have different things that you need to do to stay healthy. And so getting families to understand that there's not usually one thing that they have to do to be healthy, but they have to look at every aspect of their life when they're not well. And so whether that's sleep or their stress or their food or their friend choice, or teenagers, there's a lot of vaping in the teenage population. So, is that contributing to, or are they overusing technology? So kind of the brain gut connection, the conversation around that, it opens up so many doors for us to be able to talk to the family, because our goal is always self empowerment, right? So we love taking care of people and getting them better, but at the end of the day, we want people to leave our clinic. We want them to be able to be discharged and to have all the tools that they need in their tool belt, so they can pick the right foods for them, and they can have a diverse diet, and they know the things they need to do for sleep and the amount of exercise they need to do and the positive relationships that they have in their family and the supplements they need to take, but kind of they can take it with them, and that they don't need to come back every 6 months for us to remind them what they need to do to stay well.